Welcome back to the Dog Health Channel. Today we're going to learn all about what chiropractic care is for our animals. Hi, Dr. David Feldman. How are you?
Fantastic. How are you?
Good. Thank you so much for joining us today.
No problem.
We're really excited about learning about what all chiropractic care is for animals because a lot of us do visit chiropractors and we wonder, can we actually bring our pets to the chiropractor?
Yes.
Yeah?
You can bring your pets to the chiropractor. And treating animals has been a very, very rewarding experience for me personally, and I just love seeing the response of animals. They just do so well with it. Chiropractic for animals, while it's similar, is also different than chiropractic for humans. I always say, and I even have it up on my board here, if animal chiropractic, if it's good for you, it's good for your pet.
I believe in that. I believe in that.
Everybody has a nervous system, and your nervous system controls everything in your body. So it's so important that our nervous system is functioning at its best. When your nervous system is functioning at its best, it means your whole body is going to be as healthy as it can be. Dogs have a nervous system. It's the first thing to develop in a dog and a human. That's why it's the most important system. So if it's functioning well, then your pet's going to function better. And chiropractic is one of the ways to get your nervous system functioning as good as it can.
Well, I believe in chiropractic care, as you know.
Yes.
Now, so I guess it's very similar in the way that it works, but it's probably not the same in the way that you do. Is it like, do you need to have a special education to?
Yes. So there's a definite specialized education. I took a 220-hour course that was offered by the Veterinary Chiropractic Learning Center. This is a course that's open to chiropractors and veterinarians. There's an agreement between the veterinary college and the chiropractic college, and if you've taken this specific course, both veterinarians and chiropractors can practice animal chiropractic.
Oh, I didn't know that.
Yeah.
That's great. And so now, okay, so now we know that chiropractic is just as effective for dogs as for us.
In fact, I sometimes think it's more effective.
Really?
And the reason why is because sometimes in humans there's the placebo effect and our brains get in the way a little bit. I find in animals and even small children and kids and babies and dogs, their brain doesn't get in the way, and their body just allows whatever to happen. And they get better quicker, and they tend to hold their adjustments for longer.
So So Mabel's gonna come visit you for the first time today. And what can I expect of a visit with you?
Okay, so a typical initial visit is anywhere from 30 to 45 minutes. I like to spend a good amount of time going through everything. I start off with a detailed history. I find that asking lots of questions about the dog's past, what they've been doing, what they were doing at the park, what they're eating, gives me a lot of information. I find that I can often figure out what's going on just by history. Observation is the next thing. Very, very important. I want to see how the dog moves. I do a little bit of a gait analysis to see, their legs, how their walking is, how their running is. Then if necessary, I'll do a bit of a neurological examination. Some dogs that come to see me might have a disc problem that might be affecting their limbs, and there might be weakness. So I want to just rule out whether there's a neurological issue. Then I go through my palpation. That's probably the most important part of what I do. So from tip to tail, I go through each spinal bone and I feel for its position. I'm feeling for whether it's in the proper alignment relative to the bone above or below it. And that's really important because if something is a little bit out of alignment, the nerves are so close where they come out of the spinal cord that any little misalignment can cause pressure on a nerve. And wherever that nerve goes can cause a problem.
And you can find this fairly easily with palpation.
Right, yes.
Okay.
And once we found those areas, and I kind of combine that with looking at all of the rest of my examination, I obviously let the owner know what I have found, and then I go ahead and do some adjustments. And the adjustments are painless. It's a little bit different than humans. Obviously the techniques are very different, and there's not that big kind of cracking sound that you hear with that big release that you hear with a human, because the joints are a lot smaller. But trust me, they know what's going on, and usually I find that after they're adjusted, they'll be licking their lips. And I love to see that full body shake after an adjustment. As they're just kind of resetting their whole body and nervous system. It's fantastic to see.
So how long does it take, the first initial visit?
Initial visit is about, like I said, 45 minutes or so.
45 minutes.
And I usually do a treatment within that first visit as well.
Okay.
It's included in my initial cost because I like to have you leave and seeing some benefits of what's going on.
And are you able to assess on your first visit, like the first 45-minute assessment, that how many more visits that you would need?
Yeah, and I find that's different for every dog depending on the age and the issue. Usually if it's something that's pretty acute, meaning that it's, say, just happened, you had a dog, that another dog ran into your dog at the park and they have a little bit of a limp, it's probably something, especially in a younger dog, that's going to be pretty quick. I might need to see them one to 3 or 4 times, maybe in a short time span, and then kind of, I like to get people thinking about the prevention and the holistic aspect of chiropractic as well, and that's really what healthcare is taking care of your health in advance.
Yeah.
And so I have a lot of pet patients now that come once a month or once every 2 months, kind of whatever works for that
Like what
dog.
I do for me.
Exactly.
Okay.
It's the same kind of thing, and that way we can prevent some problems before they actually happen. And like I said, that's really what I feel that healthcare is.
And so would I stay at in the interview or the assessment?
The owner?
Yeah.
Of course, yeah. I want you to see everything, and
then you
I
can ask
explain it all.
questions and things like
I'm
that.
talking to you
Okay.
as well. But
Okay.
there is a big communication part
Yeah.
with the dog, and that's
Yeah.
one thing I really like to do at the beginning. Before I put my hands on a dog, I really want to connect at an energetic level. I mean, I feel that dogs, we can't really communicate with them
It's
verbally, so
true.
we have to find another way. And I just use my senses. I like to connect. I like to look in their eyes. I like to try to even get my breathing on the same pattern as their breathing. And that just helps me kind of connect with them. And then I, go through my exam, and I let my fingers do the walking, and I try to figure out what's going on. That being said, I want to just say one thing. I'm not a veterinarian, so I'm not going to be making a diagnosis per se about your dog. I'm going to tell you what I think is going on, and I'm totally complimentary to your vet. I want you to be going to your vet. I want them to know that you're seeing me. I'll often communicate with your veterinarian as well and send them a little note of what I found and what I'm doing.
Okay.
Because they're your primary healthcare practitioner for your animal. I'm definitely a complimentary side of things, but I like to think a great compliment.
Yeah, of course you are. So what would I look for as a pet parent within my dog? Like, when would be a good time to bring my dog to a chiropractor?
That's probably the most common question is, so how do I know? And I've been at a lot of pet shows, and I hear people walking by and they're like, how do you know that your dog needs a chiropractor?
Yeah.
I guess the biggest thing is you know your dog. So behavior changes is probably the first thing. Is your dog doing something different now that they weren't doing? Is something less? Are they not able to go up or down stairs? That's a common thing that I see. Are they coming back from a long walk with a little bit of a limp? Are they lifting a leg? Is there changes in their eating? Do they have pressure points when you touch and play with them? Is there a sore spot that they maybe will drop down when you press on? Many different reasons like that. Skin conditions. Sometimes a dog will start to gnaw on an area that might be a little bit tender. But mostly, I would say my most common patient is probably a little bit of an older dog that's started to slow down a little bit. Like I said, might not be able to jump on the bed anymore, that type of a thing. And we can really get their joints moving better and make a change. And that's really what it is. It's about kind of restoring a behavior that you lost. Because that's really what's important to the owners, is seeing that their dog be able to do something again that they weren't able to. That being said, I see things that are a little bit more serious as well. I've seen a dog right now, a couple of dogs that have some disc injuries, so we're just trying to align their spine, get all the nerves flowing to where they need to go, so that can strengthen their back legs, so they can walk a little bit better, that type of thing. I have a couple different patients that come in for things that aren't pain related. For example, I have a dog that I see regularly that has an issue going to the bathroom and actually can't pee.
Really?
And it's very uncomfortable and painful for the dog. Interestingly enough, I'll come and I'll work on the spine for a little bit, and the dog will literally pee outside the door of my office right after the adjustment. And it makes sense because, again, you're working on the nervous system. All of these nerves don't just go to your pain-sensitive areas, they go to your internal organs too. So if they're out of alignment and not functioning better, then all of your organs aren't going to function as well. So overall, when your spine is aligned, your nervous system is going to function better, your whole body is going to function better.
It sounds like we should actually go see a chiropractor just to get an assessment.
Yeah, and
Okay.
I have puppies that I've seen. often they're puppies of patients that I've already seen, and they know the value of it.
Right, right.
I find my biggest most of my patients are chiropractic patients themselves, because they realize the benefit of what it's done for them, and they're like, yeah, why wouldn't it work on my animal? So yeah, I've seen some puppies where I just give them a check. Often there's nothing to do, but the birthing process is very hard. And sometimes a dog's neck can be twisted in a certain way as they're being born, and that can cause a problem later on. I'm seeing a dog right now who was actually stepped on at a very, very young age, and its front right limb didn't grow very well. So it's going to have a lot of compensation issues because of the shorter limb. So we're working on its shoulders and its back.
So really, it's the same for us as it is for them, and vice versa.
I like
It's
to
the
think
same.
that.
It's
Yeah.
the exact same, except that you mentioned that they heal quicker. So even less visits, I guess.
I mean, if it's more of a chronic issue, if
Well,
something's a
sure.
bit longer, it's going to
Yeah.
take a little bit more
Yeah.
time and over a longer period of time for sure.
Yes.
And it also depends. There are some cases that I don't think is a chiropractic case, and I'll make the appropriate veterinary referral if I think that.
Right. Right.
I think 90% of cases I'm able to help or to attempt to help. Yeah.
That's amazing. Well, I guess what we've learned today is that you can bring your dog to an animal chiropractor who has an education towards that, and expect a 45-minute first initial assessment with a plan for the health of your dog. But you don't have to just bring your dog to the chiropractor just when there's a problem. You can actually just bring them just for an assessment to see if there's any ways that you can promote and increase their livelihood and happiness, I should say. Right? Does that make sense? Is there anything else you wanted to add that people should know about when it comes to animal chiropractors and what they can do to increase the happiness of their
I just think it's important that if you are going to decide to go see an animal chiropractor, to go to see somebody that's educated, that took extra courses, and don't just go to your chiropractor and say, oh, can you do something for my dog, just that you do for me?
Right.
Because I think it's important to be treated by someone that knows what they're doing. These are our pets that we want to spend our life with, and they're our best friends, so we want to make sure that they have as good care as we do. So I think that's a very, very important thing. And just be open to a different type of healthcare that maybe you weren't open to in the past. I think a lot of people are trying to steer away from drugs and surgery and things like that.
It's true, absolutely.
And looking for a more natural approach. And I think chiropractic is it, along with all the other type of complementary care. There's acupuncture for dogs and massage, as I'm sure you've seen in Sylvie's other videos. And sometimes supplementation. I do try to promote some joint supplements as well. Like glucosamine and chondroitin to help your dog's cartilage and their joint health in general.
Yeah. Well, that's great. I thank you so much, Dr. Feldman,
You're
for
welcome.
joining us
This is
today.
fun. And Mabel is such a good girl, sitting in my lap the whole time.
I know.
Wow.
So how can, for people who live in Toronto, how can they get in touch with you?
Very easily. My website is called mypetschiropractor.ca, so that's an easy way to find me. You'll see some testimonials on there of what I've done. I go through what I do in a typical examination. I'll probably have a link to this video as well on there in the future.
And you know what, guys? I'll put everything in the bio of this YouTube channel so that you guys can just click on that and get a direct contact with Dr. Feldman. Thank you so much for joining us today.
You're very welcome, Sylvia. It was a blast. Thank you.
Bye.
Bye.